Morning everyone. Sorry I sound like a broken pipe, but that's a cold cough, that's fine. So change is the only constant thing in life. Same way, medical field keeps on changing. There are always newer modalities which keep on coming. So it's better we keep ourselves updated over it. In this confab, we'll showcase some of the modalities which we recently started in AIG. They will showcase how that modalities work, what all the advantages they have over the conventional methods, and who are the patients who will benefit from it. So I'll request everyone to hear it properly. And with this, I'll call upon Dipti to take the confab forward. Dipti.
Good morning, each one of you. Myself, Deepthi from IPD Services, Financial Counseling. Today I am presenting on the Da Vinci surgical system. So you all know what a robot is. So we'll see what a robot does in a surgery and why we are using the robot. Robotic surgery is nothing but using a robot in surgery where the surgeon uses the robot which is under the control. It's under the control of the surgeon. It does not simply does the surgery and come back. It is completely controlled by the surgeon. So it's not like replacing a surgeon. And why the robotic surgery is used? Because combining the skill of the surgeon with the technology, enhancing the quality of the treatment or the surgery with the safety. Along with that, it has a great precision, flexibility and control. So it helps us to do complex surgeries when compared to the other two different kinds of operations, which is laparoscopy and open surgeries. We will see the comparison between robotic, laparoscopy and open surgeries. In robotic surgery, the incision is very small, that is 0.5 to 1 centimeters when compared to the other two methods. And the robotic surgery has a technology where the 3D vision is there, where the surgeon can see or the who are assisting can see in the vision card there. And the precision, it has very high precision and has a tremor filtration. During the surgery, whenever there's a little slight movement or tremors, it all gets filtered in this robotic surgeries. And the recovery time, as the incision is very small, the patients get to recover very fast, and hence the hospital stay is also less compared to the other two traditional methods, that is laparoscopy and open surgery. In the laparoscopy and open surgery, the incision is more and they had to use the laparoscope and instruments, and patient had to stay a bit longer when compared to the robotic surgery. These are the three different methods for performing the surgery. The first one is open surgery, second one is the laparoscopic surgery, third one is the robotic surgery. At AIG, we have 4 robots to perform the surgeries. One is maxillar robot, which is used for biopsy, and the second one is ROSA robot, which we use for orthopedic knee replacement surgeries, and we have Da Vinci robot, this is called as a Da Vinci X. We introduced this robot in the year 2020. This is the robot which we have. It is in 4th floor OT theatre. You can see that these are the different 3 components of the robot. First one is called as a patient card. This is placed at the surgical site. It has 4 arms and it is always covered with the drapes. One holds the camera, other holds the specialized instruments required for the different kinds of surgeries. The second one is called as a surgeon console. This is where the surgeon sits and performs the surgery. These are the foot pedals and these are the consoles where the surgeon controls the robot. This is called as the masterpiece, and the first one is called a slave because the slave does what master says, right? And the third one is the vision card where the high 3D vision is there. The real-time data is captured here. We'll be discussing on Da Vinci robot. So this Da Vinci robot is introduced by Intuitive Surgical Company, USA, and got approval in the year 2020. It is named after Da Vinci, the great Leonardo da Vinci, because he is the pioneer in the anatomy and he has a contribution in the robotics. Hence, in honoring Da Vinci, it is named after him. This Da Vinci robot, it performs various surgeries of many departments. In the urology, it does prostatectomies, nephrectomies, cystectomies, nothing but the bladder removal. And in gynecology, it does the hysterectomies, myomectomies. In gastro, normal gallbladder, simple gallbladder, cholecystectomy. And in cardiac, it does coronary artery bypass grafting. This is the evolution of the robot. The left one is the standard version, which was introduced in 1998. And the right topmost is the advanced version, what we have at AIG. This is called Da Vinci X. We will see the features of the advanced version compared with the standard version. The generation 1 has only the 3D vision and wristed instruments. Compared to the 4th generation, what we are using, it has a Firefly technology, which we will be discussing in the upcoming slides. And it has standard instruments and low-level entry point. Low-level entry point is nothing but the incision is made in the lower quadrant of the abdomen, so it is easy accessible for the surgical target area. These are the different advanced features of Da Vinci X. Coming to the software, the latest updated version has OS4 software. It controls 45 plus instruments. Not only that, even the energy is controlled, everything is controlled. Coming to the data and analytics, it provides the data of the instruments. As I told, it has 45 plus instruments. Each instrument has its own specification and use. Like few of the instruments are to be discarded over a period of time. So it provides the real-time performance data of the instrument. Not only regarding the instruments, it provides the data of the surgeon performance also. Like it's giving a report card, like how well the surgery went. So we can see the areas where we can improve after the surgery. And learning, it has a simulation technology where the surgeon can practice in virtual reality. The surgeon can practice the surgeries in virtual reality. Coming to the integration, the components of robot talk, it's not like the human talk, but the surgeon hand movements are converted into precise motion. This is how integrated this Da Vinci robot is. Coming to the instruments, there are 45 plus instruments: endowrist, monopolar cauteries, bipolar cauteries, scissors, clip applicators, drivers, graspers. We will see few of the instruments and their uses. Example, this endowrist graspers are used particularly for fine tissue handling and controlling, which mimics the human hand, which is predominantly used in the general surgeries. Whereas in the urology, especially like for the prostatectomy, where this is a little delicate, as these endowrist needlers are used for precise suturing. And in gynecology, we use vessel seal extenders. These are the few different types of instruments where they are predominantly used in different departments. Along with the instrument, these are the different stapling components. It has a smart fire technology, full articulation, 120 degrees, and full surgeon control. It is controlled by the surgeon, and it has a variety of reloads of different colors which can be used for the different departments. It monitors the tissue before the compression and while firing the process. It can make an automatic adjustments also. These are the different types of stapling components like Surefom 60. Based on the size of tissue, this component is used. Example, the Surefom 30 curved tip is used for the smaller vessels, smaller thinner tissues used in the pediatric surgeries. Da Vinci energy. The energy is coming from this generator called as integrated Irby Bio generator. It provides the energy for cutting and coagulating the tissue. with the help of these two specialized instruments called as the vessel seal extend and synchro seal. This helps for the precise, fast, low temperature tissue sealing, cutting and coagulating. This is the imaging. As I already told, this robot has a firefly technology. Means the surgeon can inject a dye, so he can look into the deeper blood vessels. If not, there are any tissue perforation is there. So this is the technology called as a firefly technology. It has high defined visualization, 3D HD, and the picture is very clear, clarity, crystal clear, and high integrated endoscopes are there. This is the advantage of that Da Vinci robot. As I previously discussed the benefits, like when we compared the robotic surgery with the other two traditional methods, the incision is very precise, 0.5 to 1 centimeter. So the incision is very precise, so the patients get to recover faster when compared to the other traditional methods. Hence, there's a very less pain and discomfort. As the incision is very small, there's a less chance of getting infected. And it has a better screening also. As I already told, 3D HD view is there for this robot. We will see how this robot works.
The Da Vinci surgical system is the most advanced platform for minimally invasive surgery available in the world today. The integration of high-resolution 3D vision, wristed instruments, and intuitive motion control enable the Da Vinci surgeon to transcend the limitations of conventional surgical technologies. Three network components comprise the Da Vinci surgical system: an ergonomic surgeon's console, a patient-side cart with 4 interactive robotic arms, and a high-definition 3D vision system. Seated at the console, the Da Vinci surgeon views a remarkably clear 3D image of the surgical field. The system scales, filters, and translates the movements of the surgeon's hands on the master controllers to 4 interactive robotic arms on the patient cart. The precisely controlled micro-movements of the Da Vinci instruments are enabled by the computer processors of the system. These dedicated processors perform millions of safety checks over the course of a procedure for enhanced surgical precision and control. Da Vinci EndoWrist instruments are designed with a unique wristed architecture that provides 7 degrees of freedom for a range of motion greater than even the human wrist. This proprietary design enables surgical maneuvers impossible with conventional laparoscopic tools. The system requires that every surgical maneuver is under the direct control of the surgeon. Redundant safety checks prevent autonomous movement of the instruments or the robotic arms. The Da Vinci S surgical system moves surgery forward with a new level of technical capability that enables minimally invasive surgery in complex procedures as never before. Da Vinci provides a streamlined surgical experience that benefits the hospital, the surgeon, the OR team, and, most importantly, the patient.
So you all saw how the Da Vinci surgical system works. With this, I would like to conclude that the robot does not replace a surgeon, but adding with the skill and the technology, the surgeries can be performed in a better way, improving the quality with the care. So we are in an era where impossible surgeries are becoming common, that we are performing many surgeries which are very hard to perform previously. So it's not a robot, but Da Vinci is just not a machine or a robot, it's the future how we heal. I thank each one of you for your attention. And now I call upon my colleague Ms. Madhumati. She'll be presenting on topic regenerative endoscopy. Have a good day.
Good morning, everyone. This is Madhumanti from Daycare. I'm currently working as a senior operations executive. Today I'm going to present on the topic regenerative endoscopy, which is an emerging approach in gastroenterology. We are moving out of the era of managing diseases and into the era of biological restoration. What you will be seeing in the upcoming slides is the integration of the laboratory and the procedure room, a world where we no longer just resect but also regenerate. Regenerative endoscopy is also known as stromal vascular fraction or SVF. It is a minimally invasive procedure that uses endoscope or a colonoscope to deliver biological materials like stem cells, growth factors or tissue scaffolds directly to the affected area on the GI tract. Back in 1966, Professor Martin Rodwell has introduced a very interesting concept regarding the adipose tissue, that it is not only just a grease, but it also holds the power to heal certain organs in the human body. In 2001, it is then discovered that the fat could be emulsified, and the surgeons were using it in the plastic surgeries and the orthopedic surgery. Subsequently, the endoscopic wave emerged, where the researchers in Gemelli, Rome, identified the potential of endoscopic application on this approach. At AIG Hospitals, we adopted and started practicing this approach back in 2025. They are the key stakeholders for the entire procedure. It begins with the patient, followed by the gastroenterologist and the plastic surgeon who performs the procedure. The biochemists play a crucial role in the processing, while the anesthesiologist not only just ensures the patient's safety but also manages the entire sedation process. The entire procedure is supported by our extremely skilled technicians and nursing staff, and also the support team along with the administrative staff who ensures the smooth coordination throughout. I will also explain the role of the major stakeholders in my upcoming slides. Now I will briefly walk you through the entire process from harvesting to healing. The procedure involves 3 key steps. First, the plastic surgeon will harvest the adipose tissue from the patient's body by performing a mini liposuction, typically from the thigh or the hip region. Next, the biochemistry team processes the tissue by centrifuging it in 3000 RPM for at least 3 minutes at 24 degrees Celsius to obtain the concentrated regenerative cells. Finally, the gastroenterologist performs an endoscopic procedure to inject the isolated cells directly into the affected area of the GI tract. These images represents the real-time visuals from our procedure room, giving a practical view of the entire workflow. They highlight the key stages from harvesting and processing the final stem cell layer obtained after the centrifugation process, seen as the pale yellow fraction color as shown in the 4th picture. This is the component that is used for the targeted endoscopic injection. Also, I would like to add one more point, that in this picture, the clinically progression has been shown and demonstrates the outcome of the entire procedure, starting with a 1.2 centimeter of a fistula at the patient's initial visit. And after we performed the procedure on the patient, there was a partial closure at 6 weeks and eventually a complete closure after performing multiple sessions. There are 6 main reasons why the gastroenterologists perform regenerative endoscopy over a traditional surgery. Firstly, it is a very minimally invasive procedure that does not require any kind of large incisions or stitches or any extensive surgical intervention. This allows the patient recover much faster than a surgery, and in many cases the patient can be discharged on the same day itself. It also reduces the risk of complications such as bleeding, infections, or any kind of leakages. Another important advantage is the organ preservation, as the procedure targets only the affected area in the GI tract while keeping the whole organ intact. Additionally, it promotes the faster tissue healing and regeneration. Compared to a surgery, it is also more cost effective than a treatment option. So from an operations perspective, this slide outlines the complete patient journey, where the patient identification and the clinical counseling is carried out by the consultant itself, himself or herself, following few diagnostic procedures. Once advised for the treatment, our operation teams handle the financial counseling and explain the expected hospital stay or prerequisites, if any. After the patient consent, we ensure a smooth admission process for already admitted patients. Timely shifting to the recovery, which is located in Tower A, second floor, is also coordinated. During this phase, all the necessary consents, PACs are done by our extremely trained nursing staff and the DMOs who guide them throughout the procedure. Once the patient is prepared, they are shifted to the procedure room for the procedure. Post-procedure, the patient is moved back to the recovery again. For observation, typically we keep the patient for observation for at least 3 to 4 hours or for a longer period of time if advised by the doctor. Finally, after the doctor clearance, we ensure all documentations, billings and reports are completed, enabling a smooth and timely discharge process. As mentioned earlier, this program was initiated by AIG back in 2025. As of today, we have operated on 25 patients with multiple sessions, and we are pleased to report a success rate of over 90%. Finally, coming to the patient eligibility, this procedure is not suitable for everyone, so selection of the patient is very important here. Patients who are ideal for this procedure typically includes those who have fistulas present in their body, or any non-healing ulcers, any GI strictures or narrowing, post-surgical complications if any, and early tissue damage or precancerous conditions. On the other hand, the procedure may not be suitable for the patients with advanced malignancy, severe systematic illness, or any active uncontrolled infection, where the risk may outweigh the benefits. It is very important to note that regenerative endoscopy is still evolving. Some therapies are currently available only under clinical trials or at specialized centers. Thank you so much for your attention, everyone. I would also like to add that AIG Hospitals has introduced a very advanced technology called ZAPEX. To provide further insights on this, I would like to invite my colleague Abhay to briefly explain on this topic.
Good morning everyone, I am Abhay Mansingh, Deputy Manager IP Operations. I have been associated with AIG for the past 2.5 years. Today I would like to explain you about ZAPEX, which is recently installed in our hospital. How many of you have heard about ZAPEX and where it is located? It is located in ground floor. So JAPEX is a revolutionary radiosurgery technology. It is used for advanced radiosurgeries. The system was invented by Dr. John R. Adler, who is also the inventor of CyberKnife technology. The system is based on SRS technology. So what is SRS technology? SRS technology is stereotactic radiosurgery technology. It is a non-invasive procedure. It does not require any incision or open surgeries. In this treatment, high precise radiotherapy is used to deliver the high dose radiation to a very small precise location. It is used to treat brain tumor and neurological conditions. JAPEX is the world's first and only self-shielded design machine which does not require any concrete bunker. It is gyroscopically rotating radiosurgery system, which means the machine rotates gyroscopically and delivers the radiation beam. Now we will go through the clinical applications of JAPEX. The departments which are involved in the use of this technology are mainly neuroscience and radiation oncology. In some cases, radiology and anesthesiology also plays the role. Before a patient taken to the procedure, a CT or MRI is needed to confirm the diagnosis. After that, a tumor board meeting is conducted with the respective doctors. In this meeting, the patient's treatment plan is decided. After that, the patient and family members are counseled regarding the treatment and consent is taken. The conditions we can treat are arteriovenous malformation, brain metastasis, trigeminal neuralgia, acoustic neuromas, pituitary adenomas, meningiomas. It is specifically used for small lesion less than 10 cm and Parkinson disease. Now we will go through the clinical applications. Now we will go through the alternative treatment option and see what are the advantages of JAPEX over other alternatives. Gamma and CyberKnife are the alternative treatment option, whereas CyberKnife is the closest alternative option of JAPEX. CyberKnife can treat more tumor in all over the body, whereas JAPEX can treat tumor is in the head and neck area. CyberKnife can treat tumor size more than 10 cm, whereas JAPEX can treat tumor size less than 10 cm. Unlike CyberKnife, JAPEX does not require a concrete bunker because it's a self-shielded machine. The precision level of JAPEX is very high. It does not require any incision or stitches. Where JAPEX is the treatment option, the surrounding tissue are protected and there is a minimal leak of radiation. The treatment time of JAPEX is very less compared to CyberKnife. It usually takes 30 to 45 minutes. As there is no requirement of any bunker and the treatment time is less, so the operational cost is also less. There are 4 stages in which the treatment is provided using JAPEX. First is positioning. Once the patient gets onto the machine, the mask is fixed and aligned. Next step is imaging, where the real-time CT verifies the exact location of the target. Then comes the gyroscopic delivery, where machine rotates around the patient and provide radiation beam from multiple angles. Lastly, dose confirmation. It verifies the planned delivery dose is delivered accurately to the desired location. Now, core technologies which provides treatment by using JAPEX are gyroscopic design, where the machine moves around the patient and provide 100 of multiple beams from multiple angles that converge on the target. Real-time imaging, where cone beam CT provides verification of exact location of the target during the treatment delivery. It is a self-sealed designed. the system blocks extra radiations and there is a minimal leak of radiation. It is based on SRS technology, a very accurate treatment option that only targets the problem area. Let's understand the economics and logistics. Each JAPEX procedure costs around 2.5 to 4 lakhs depending on the lesion size and treatment planning. The total duration period is 30 to 45 minutes, including setup and imaging verification. JAPEX is a day care procedure, so patient can go home on the same day. What are the requirements for infrastructure and investments? JAPEX requires less infrastructure space compared to the traditional systems. The total the total space is required approximately 1000 square feet to 1500 square feet. It includes the UPS room, equipment room and control console area. The JAPEX system cost approximately 35 to 45 crores. In this slide, we will see the statistics of clinical outcomes and the patient benefits. Tumor control rate is 95% for brain metastasis and 85% pain relief success for trigeminal neuralgia patients. 98% patient satisfaction due to it's a non-invasive procedure, and 90% patient can be discharged on the same day because it's a day care procedure. The second machine in South Asia was installed at AIG Hospital, Gachibowli, and the first machine installed at Indraprastha Apollo, Delhi. The inauguration was held on March 7, and the inventor of the machine, Dr. John R. Adler, is also present during the inauguration ceremony. The machine is installed at ground floor near the pharmacy. Thank you.
Thank you. Thank you, Abhay. Thank you, Madhuvanti. All three can come on stage, please. It was definitely a very precise and insightful session. So, any questions from the audience? Okay. So there are few more updates. To be precise, two updates. One is the ZAPEX, which we inaugurated recently on 7th. Second is we have started with a report dispatch cockpit. So now this cockpit will enable our operation team and even the nursing team to give the patient any reports, irrespective of which department it is, on WhatsApp. They can send it by email. In fact, they can even print from that side. So it's more of a concise and a robust system rather than getting into a different portals and getting the printout part. So I request everyone to use that cockpit because it is more of a structured report. So even the report format is being designed properly. Thank you. Anything else? I'll call upon Capri sir.
Thank you guys. I think we need to clap for them. Their first presentations, wonderful. So I just wanted to take a moment out to talk about something which our team has been planning for some time now, but I think now the time is right to talk about it. So hopefully this month, we are planning to launch in what we would like to call as a leadership development initiative. So this leadership development initiative is to select about 10 to 15 upcoming stars of AIG Hospitals. This people will go through 1 year structured training by the team. So it is by the operations team, for the operations team, It's not going to be an HR initiative or any such thing. It's the operations team which will take over it. The process is very simple. It will have a form and you have to apply for it. Obviously, tenure in AIG Hospitals will give you credibility, but ultimately it will be the application form as well as an interview which will finally make you go through it. This will, if you do ChatGPT, will get to know, so you fail. Okay, so whatever form you have to fill up has to be your original thoughts, your view, and answer the questions in a very earnest way. If you see all of that, definitely you get bonus marks. An interview is also very important. But the idea largely is that to have this program run year on year for the next few years at least at AIG Hospitals, and use people from this program to get better jobs. Does it assure a growth? The answer is a big no. Of course, you have to do well in those assignments that you've been given. You have to attend those classes regularly. So those count. But definitely if you do well, yes, then it's an assured growth. You will grow within the AIG system. It will be, it's not open for all. You have to have reach a certain level to qualify. So at this point we are looking at assistant managers and above to go through this program. But every year we will keep doing this, and hopefully every year a dozen plus people from our system should benefit from this and hopefully grow within the AIG system to take up better roles. When we have more details, we'll get back to you, but hopefully in the next 2 to 3 weeks, you will hear back from us. So that's all from my side. Let's have tea together. Thank you.